I want to start with that last finding about transmission rates with ages. And as you get down into the early elementary school years, those children seem to be less likely to transmit. But what I just saw in those ages in the South Korea study, high school kids seem as likely to transmit as adults of any age.
Right. So what we know is that children are going to be less likely to develop severe disease from COVID-19. Now, that doesn't mean that they can't develop severe disease, but it's going to be less than adults. What we don't know is how efficacious children are at transmitting the disease. And this is incredibly important to know as we're talking about reopening schools. And there's a lot of conflicting data. So there's a large study from Switzerland in pediatrics that suggested that children less than 16 years of age are going to be less likely an index case in a household to transmit the virus to other people. But now we see this South Korea study, which again supports that children are less likely to be the index case. But when they are the index case, children from ages of 10 to 19 are going to be more likely to induce secondary attacks. So they're going to be more likely to spread the disease in their household. What remains unclear is outside of that household, you take them into their activities, put them into schools, what that transmission is going to be like. And the bottom line is we don't have that data, and we really need to understand how children transmit to children and how children transmit to adults when we're talking about activities for children, getting children back into schools. And that data is just not robust enough at this point.
What did we learn from summer camps this year? You're quoted in Bloomberg's report about it today. There are many, many, many summer camps that just gave up, did not open, stayed absolutely closed. Others that opened, some opened and did what they thought was their absolute best at taking precautions, but it wasn't good enough.
Right. I've been actually very impressed with many summer camps, specifically ones in Texas, which is where I'm located, on the steps that they have taken to try and keep children safe. The issue is that when there's exponential growth within the community, there will be children who get infected. And so what we don't know within those summer camps is, are those cases coming from children from outside the community that got infected in their household and bringing them into the camps? Or are they spreading it in between children at the camps themselves? So is this indirect, meaning they're bringing it in and we're just detecting higher cases because now we're testing? Or is it because the children are able to pass in between each other? And the answer is, from what we know so far, because the contact tracing hasn't been completed, is we don't know. And so it's not unreasonable to think that this is a reflection of that exponential growth and indicate to us that when you have exponential growth within the community, you're going to see increased cases in group activities for children, whether it's camps or opening schools.